Liver disease affects and hurts and even kills many, many people in this country. I believe it's, when it comes to cancer, it's second only to tobacco. Hepatitis B is when it comes to deaths in this country. Now, the Liver Foundation does a lot of good work and a lot of research into diseases of the liver. In fact, this country is one of the leaders in finding cures and treating symptoms of this disease. Now, two people that have done a lot of work helping raise funds for such work are George Marcello.
That's right.
Did I get it right?
You got it right.
Oh, we're on a roll.
Yeah.
And now here's where we come to a stop. Tom Ondrejka.
Ondrejka, close enough.
Ondrejka. Okay, great. Now, George, let's start with you.
Okay.
Now, I was reading in your bio. Now, you, of course, suffered from hepatitis B.
Right.
And you received a liver transplant?
Yes, 2 years ago.
Okay. Now, how did you contract the hepatitis B?
I contacted hepatitis B when I was young in Europe, and after that it just progressed.
And you had to wait, of course, for a transplant.
Yeah, I think I waited close to a year, but I was diagnosed to die about 5 years ago.
Wow.
Yeah.
So, and I understand in this country, it's people that are diagnosed and do wait for the transplants. Not all of them make it because there is a shortage.
Absolutely.
Of organ donations.
Absolutely. And I don't know the exact statistics on it, but there is a lot more people suffering from the actual disease than people really realize.
And the other thing is, when it comes to the donations, I guess it would be worthwhile for people to fill out the card on their driver's license.
Yeah, yeah.
Because they're not going to be doing anything with it.
Exactly, exactly. And I think that's one of the things that we're hoping that'll accomplish with our future endeavors is to get that more on the rise, so to speak. It's maybe develop a new generation of.
Now, I understand you were involved in raising funds and awareness
Yes.
through a walk.
Yes.
And can you tell us a bit about this? I guess did it start in Ottawa?
No, it started in Toronto. Actually, it was more centered around the awareness, this walk, that walk. We started in Toronto August 17th, and it took us 12 days before we reached the Burning Flame in Ottawa at the Parliament buildings. And it was quite a trip.
Yeah?
Yeah.
Did you get a lot of good press, etc.?
Yes, yes, we did get a lot of good coverage. Everybody was really great, you know, in that respect. We also had a chance to talk to thousands of people and just talk to them about liver disease, and it was just amazing the response that we got with it. And the underlying two themes were that there is a lot of misconceptions about it. And, you know, at least 75% of people that we talked to, they either had a friend or a family member that were afflicted by it. So I guess what we were trying to do is just raise the profile of the Canadian liver disease and try and bring more awareness. Our future endeavor, hopefully we're going to try and make a few funds too.
Okay, and you're saying, you were talking about raising people's awareness, because
Right.
people just don't know a lot about it. And I know one of these ways, Tom, you're working with members of the Canadian Football League, the oldest sports league in North America.
Yes, yes.
Right?
And after you get a chance to work with them, actually one of the best. They've been extremely supportive and helpful for what we're doing. The program's called Touchdown for Tomorrow. We started the campaign last year with the Toronto Argonauts, and this year we've taken it right across the league. And part of what George was talking about is getting the message and getting the information out there. The bottom line with what we're doing with hepatitis B right now is really you're trying to educate the public as to what it is, why they need to be immunized, and the reasons for it. And that's really the biggest issue that we're trying to address right now.
Yeah, I've noticed that in reading your clippings, etc., you've had players out there getting immunized for hepatitis B. And that's something, truthfully, I didn't know that there was a vaccine available for it.
Yeah, there's
I
a
understand the best vaccine was developed in Alberta by a physician in Alberta, and the vaccine's only been around for, what, 15 years or so?
Yeah, it's been, I mean, in the scheme of vaccines, it's been relatively a short life. The vaccine is excellent, though. You can be vaccinated against B or A. We've had two player representatives from each CFL team, and they're kicking off the campaign. The message is, listen, it doesn't matter whether you're healthy, how big you are, how good looking you may or may not be, whether you're white, black, or any color, it doesn't matter. You can be affected by this disease. And, but the bottom line is, if you're immunized against it, it's one less thing you have to worry about today.
Yeah, I just wanted to add, because it's kind of a shame that there is a vaccination out there and people are still getting hepatitis, and some are dying from it, you know. So it just, I mean, it's almost a shame that that's happening.
Yeah, it's completely preventable with the vaccine.
Yeah, oh yeah, 100%, yes. Okay. It's the only STD that is preventable by vaccine, which is an incredible statement. And part of the Health Canada now, their mandate is to immunize people across Canada by the year 2000 in a grade school level. So this is part of the program that we're doing with the CFL.
So if you are out of school right now and you want to get immunized, you can go to your own family physician?
Yeah, you have to contact your doctor and let them know that you want to be immunized against hepatitis B.
Is this covered by OHIP?
No, it's not that I'm aware of. It costs around $100 or between $60 and $100 in most cases.
Well, it's got to be worth it.
It's well worth it, yeah.
Potential life-threatening disease.
Yeah, exactly, exactly.
Okay, and I wanted to ask you how you got the Canadian Football League involved with the Liver Foundation.
Well, one of the things that I have to do in my position as trying to market the Canadian Liver Foundation is try to put together an avenue that people are going to respond to. Today, professional athletes are always a good ticket item. We need to get the message across. We need to be able to have shows like this covering the story, getting people to be aware of what's happening. The one way to do that is to incorporate professional athletes. We initially met with Paul Mazzotti of the Argonauts last year during the Craig Cup season. He was fabulous. He did a number of things for us, and now we've taken that to the next step and included the rest of the league.
Well, George, you've got to be a great spokesman for this too, because I mean, you suffered through it. Mm-hmm. You were told that there was a good possibility you were going to die. Mm-hmm. Lucky enough, you got the liver transplant. Mm-hmm. But all this could be avoided with just a simple vaccination.
Yeah, absolutely, absolutely. And it's really just out of gratitude that my motivation for all this. Like I really feel I'm one of the lucky ones, and I'm just trying to not have anybody go through what I had to go through, and it is preventable, but it is out of gratitude that all this is being done.
Now, how are you now since you've had the liver transplant?
How am I now? Well, 100% sports. Some people call me crazy because 3 weeks after I had the transplant, I was playing baseball. Doctors were telling me not to. Life has just been beautiful. It's just been beautiful, and I just had this urge to kind of pay back and hope that people won't have to go through what I went through, and it could be done. Like people don't have to.
It's terrific that you got the second lease on life.
Yeah,
good for you.
Yeah.
And I think we should encourage people to fill out their donor cards on their licenses, because they're not going to be doing anything with it after they're through. And you can give someone the gift of life. Terrific for you. And the whole thing can be avoided if we just tell people to get immunized for hepatitis B.
Yeah, that's one of the solutions. I mean, there's a lot of different elements that affect the liver and affect liver disease, but the one that we're focusing on right now is hepatitis B because it is relevant to the school system. Kids and teenagers tend not to think things are going to affect them, and this is one area where 3 simple shots will take care of them, and they will not contract hepatitis B for the rest of their life. So.
Terrific. George Marcello, great work you've been doing.
Thank you.
Thanks for coming on the show. We really appreciate it. And of course, Tom. Tom, I'm just at a loss.
I'm the only Tom here, so that must be me, Andrejka.
I know. Yeah. I know it's an easy name to say, but you know how I wrestled for about 6 days trying to say Bingaman. So this is the type of guy you're dealing with today. Anyways, you're from the Liver Foundation. Yes. It's great work that you're doing with the CFL. Great to get the exposure. I'd like you to, if you could come on the show again, and we can talk about the other factors that the Liver Foundation deals with and things besides hepatitis B. There's a whole lot more to it, isn't
there?
Yeah,
there is.
Okay, great. Thanks for coming on the show, fellas. I know for further information, people can dial 1-800-563-5483.
That's the number. That's our Toronto office.
And you'll give out information. People want to make donations?
They can call anytime.
Call that number.
Yes.